Hi, I'm Andrew Tan, Managing Director of MD Pharma Sdn Bhd. Currently, I'm the Deputy President of Malaysian Pharmacy Society also. So back to my company, MD Pharma. I started MD Pharma 5 years ago at a very so-called at the old age. But age is not an issue. Everybody, if you have the entrepreneurial mindset, I think there's an opportunity, then you go for it. So I started this MD Pharma 5 years ago by the heart and passion of providing skin solution to the consumer, and also dermatologists and doctors and pharmacists. So by that, I started this company with the skin management. Start with skin management first, and I focus on acne, I focus on fungal infection, I focus on atopic dermatitis, which all these skin problems are widely faced by our patients in Malaysia. Throughout these 5 years, I really thank my team, the sales team, to help me to grow the business and to grow the sales to a greater height, so that although last 2 years the COVID-19 pandemic, we still grow our business, and I really thank God for that. And today we are here. The most outstanding achievement is for the last 6 years, we have been winning the Consumer Choice Award by Natural Health magazine, or 100 Comments. We managed to receive this Diamond Award. The other one is the Malaysian Fashion, Modeling and Pageant Award. I think this is a great recognition for the company MD Pharma. Besides that, we also, last year during the COVID-19 pandemic, we managed to launch our in-house brand. And because like what I say is health is beauty, I always believe that beauty and then skin. I mean, everybody appearance is important. So last year we managed to launch our own formula and own product called Gutago and UV Care Sunscreen. So this is a great achievement, and we will continue to provide a better solution to the consumer. The biggest challenge faced by pharmaceutical industry, there are a few. Okay, I mean recently, I think in the past, that people say that pharmaceutical industry, you can, is a gold mine. You can make a lot of so-called money, but today, no. A lot of pharmaceutical company, especially multinational company, they are facing merging, acquisition, all these things. Why? Because the R&D cost has increased tremendously. This has made the cost of goods or cost of drugs increase tremendously. So in order to manage this situation, a lot of companies, no choice, they have to merge or so-called taken over by another company. And second thing is basically generic drugs, which in Malaysia, government is encouraging generic drugs, so that a lot of companies also facing, industry also facing a lot of issues, especially original drugs. So that not in terms of pricing, the generic is much more cheaper than original drugs. Then third is consumer confidence and knowledge. Today, consumers, they know a lot of things, so that self-medication is coming into the picture. So a lot of consumers, they treat themselves instead of going to see doctors or see sometimes seek counseling from the pharmacy. They will do self-medication. They will not buy certain health supplements to do prevention. So all these things, make the so-called the changes, so that the industry not have to cope with all these changes. And then drugs, so-called, we always believe that prevention is better than cure. So now consumers are going to prevention instead of cure, treatment. So you can see that health supplement in Malaysian market is increasing. So instead of drugs people switch to generic. So the market trend, if it start to change. And then the other thing is basically online, digital era, especially the last, I think since early last year, COVID, MCO, a lot of people, I think all of us will stay at home and we start to look at our laptop, we look at our mobile phone, look at the Google. So everything is going into digital and going to online. And whatever things you buy through online. You call Grab, you call Panda, food, clothing, even nowadays medicine. You also ask the hospital or clinic or pharmacy to deliver to your house. Supplement, everything, skincare, you order through online. So this online platform has made the whole industry change, transform. So that the industry, whatever company, they want pharmaceutical company, they have to face these changes. But bear in mind that in this pharmaceutical industry, you still have to abide the regulation. There is a regulation to control all the sales of medicine, like Poison Act 1952, then Medicine Advertisement Act. So all these things, there is a law to control. So that you still have to refer back to the regulation to make sure that whatever things you buy online is legal. Entrepreneur to me is basically the moment that you have a new idea, the things that probably you are expert in, then you look at the opportunity, then you turn this opportunity into the business. Lastly is basically to make sure that there's a profit to sustain your so-called the operation. So this is called entrepreneur. I would like to hashtag the word called spirit. Basically the spirit stands for, first S stands for service excellence. I always believe that in business we have to provide excellent service to our customers, so that your customer will support you. Second, P stands for performance oriented. So performance oriented, that means KPI. So if everybody, in business that the KPI is important, so that performance driven, so that everybody will not achieve a great result for the company. Third is integrity. Integrity is very important in industry, in business. The word trust. In the past, from our grandparents or whatever, trust is an important word that for business. We need to practice integrity, honesty in all the business dealing. Okay. Then the other one is R, so respect for people. We need to respect for people, respect for your customer, respect for your staff, respect your boss, respect everybody. The other one, I, okay, innovation. So I always encourage my team to have innovation. When you face a problem, you must think in a creative way. Definitely there will be a solution. So in everything that we face, there will be a solution. Lastly is a T. T stands for teamwork. So I always believe that team can make things happen. So whatever things you can, with the team, you can make a great result. So this is the spirit that I always hold on. What you call is a hashtag that I always put this in my mind, and also put in my company and put into the whole team also. So they carry this every day, so that the whole everybody can achieve a great result at the end of the day. Favorite time of my day is basically Not after hectic day, right? Morning wake up, thinking of the sales got order or not, or what are the plan that need to implement. The most I like the day is the time I want to spend is basically after work, evening time, which I can spend my time with my family, with not together dinner with my family, and then also I used to do some exercise, the so-called slow walk in my so-called housing area, or jogging. I always treasure that period of time to recharge myself also. This question is very tough, but I will give that one ingredient is called spice or chili. Why I say so is basically chili or spice will give the moment that you have it, it will make you excitement. So you forever remember what you have. CPD. CPD stands for Continuing Professional Development. Basically, in layman terms, it's called Continuing Professional Education. So basically, we need to continue to update our knowledge, and then now we can attend. Like I'm a pharmacist, so there are many platforms for me to attend, like conferences, seminars, workshops, and then nowadays Google online, you can find a lot of up-to-date knowledge or up-to-date medication in online or through this so-called seminar. Especially like for example now COVID-19. So COVID-19, the information as a pharmacist, we need to equip ourselves with all these COVID-19 information, like those vaccine, all these things, so that we can help the consumer, the public, to let them know the importance of this vaccination, to encourage all the Malaysian citizens to go to take the vaccination, so that we can get over this COVID-19 pandemic. Recently, community pharmacy, I did the 28 March, managed to so-called convince the government to recognize the community pharmacists as the frontliner for COVID-19 pandemic, as a help in the healthcare system, so that they are part of the phase 1 vaccination program. I think everybody knows that the doctor diagnose, pharmacy dispense. Okay, so according to the Poison Act 1952, our regulation, so the medication basically can be divided into two major groups. You call poison C and poison B. Okay, poison B medication, you need to have a prescription, doctor prescription to prescribe, to dispense. Then poison C can be dispensed by pharmacists without prescription. So to DC whether a pharmacist can prescribe medication or not. If it's a poison C, pharmacy can prescribe. Especially, example is for like those minor ailment. I give you an example, like let's say a patient comes with eczema, skin allergy. As a pharmacist, you can look at the skin problem, minor skin problem, so you can recommend basic management of eczema is cleanser. First step is using good cleanser. Second step is a moisturizer. Then third step is a treatment with so-called steroid cream. So it depends on the so-called the seriousness of the skin allergy or eczema. So if mild, so pharmacy can tell the patient that you can use a cleanser, and then the most important is use moisturizer to apply. So if let's say there's an inflammatory lesion, then you just apply this one of the steroid cream. So steroid cream, topical cream basically is under poison C. So pharmacy can do this minor treatment. If they have fever, they have coughing or flu, So my suggestion is to have a proper diagnosis or testing, especially during this COVID-19 pandemic. And why? Because if you do the so-called proper diagnosis by the doctors and then or do the COVID-19 testing, so then you can confirm that whether you have this or COVID-19 or not. It's important so that to make sure that we take care of other people also, especially those family with elderly people. Pharmacy, in the past, I think you see the pharmacist is basically dispense medication in the past, probably 30 years ago. But today, pharmacy has evolved, has transformed to more patient-centered, not product-centered, for example, and also they transform into a specialty. Example like smoking cessation, like oncology pharmacy, geriatric pharmacy, all these are we call specialty that a pharmacy is going into and provide that kind of specialty services to the patient. So these are the few examples. There are many more. In so-called in the industry, pharmacy also can go into like regulatory affairs. Medication, basically you need to register and controlled by the Ministry of Health, so that the pharmacy who are in regulatory affairs can help you to facilitate all these registration issues. The hospital pharmacy also transformed. In the past, when you visit hospital, you go and see doctor, you come out, you go to the so-called pharmacy counter to take your medicine. So the pharmacy will calculate how many tablets, all these things, and then dispense the medication to the patient. So this is in the past. But today, the pharmacy in the hospital also walk into the ward. They also do work round, that kind of services. So it's more patient-orientated services instead of only the behind the counter. The other one is there's a bit of setback is private primary care, which is today you see that the community pharmacy, they don't have a pharmacist in the clinic. My dream is basically not in dispensing medication. This is a pharmacy right to dispense medication. So hope that one day our healthcare system will be transformed, especially in the private primary healthcare, so that the patient can get the quality and safe medication. Malaysian Pharmacy Society basically is a new name since last year. Okay, we changed the name. In the past, we called Malaysian Pharmaceutical Society. So, but why we changed the name to Malaysian Pharmacy Society is basically this society represents all the pharmacists in Malaysia, and it is the home for all the pharmacists, and it's a voice for all the pharmacists also. We channel all our voice to this society. This professional body is basically not to help to enhance the ethics and professionalism of all the pharmacists in Malaysia. The motto of MPS is basically berhemat untuk kesihatan rakyat. There's an impact in the beginning of this pandemic. I remember back to January 2020, when China declared that no export for all the so-called raw material or whatever goods from China, and people start worried. My product, we not only from China, we also import from Indonesia, Thailand, Japan, France, and other countries. So we are still okay, but that period of time, there's a critical point that we need to think out the box to manage the situation. A lot of people panic, but I tell myself I cannot be panicked. So I need to think out the box to be creative enough. So back to the hashtag innovation, so that we have to think a creative solution to manage this pandemic, COVID-19 pandemic, so that minimize the impact of this pandemic towards my business. The first thing I do is I meet my team. I cannot have a so-called company meeting, so we only can do telephone call or through WhatsApp. So basically we make use of the WhatsApp to communicate, so that I encourage my team to use their creativity, to make use of the technology, to make use of the telephone call, to make use of the WhatsApp, to make use of the SMS, even the Zoom call. So communicate with the customers, so that in order to sustain the business, so that most of our customers understand the situation. They also don't want to, also close down, don't want to see the sales rep, so that they understand, so everything through technology. So far so good, business still sustainable, and thank God that we are growing. Hope that this year we can grow further. I will start with three key words, which is a new idea, new goal, new opportunity, not in a new normal way. Okay, example, firstly, I think pharmacy should venture into health, beauty, wellness. So I always believe that prevention is always better than cure. These are the areas that pharmacists or this industry can venture into. And the market and the industry is big. People, consumer, public, they also start to think of prevention. And then the other area is anti-aging. Everybody try to avoid aging. So this is another area that we can look into. NCD, non-communicable disease, aging population. Pharmacy should go into this area, how to help this aging population to manage their medication, so that they can live well and stay healthy, especially the compliance in terms of the medication. Third, basically, pharmacy can help the government in public health. Example, COVID-19 pandemic, community pharmacy play a very important role, so-called to do advocacy for the vaccination. Play a role to encourage the patients, the community to come forward to register vaccination program through the MySejahtera. This is another role that pharmacy can play, especially for the community pharmacy. And besides that, those pharmacies are in private sector or public sector, they also play a role to encourage the community to go for this vaccination program. I think there are many roles that the pharmacy can expand. The message is also to all the pharmacies is we need to, and today the pharmacies there are about 22,000 pharmacies, registered pharmacies in Malaysia. The number is increasing. So we need to expand the role, so that all the pharmacies have the role to play. The role can be in regulatory affairs, hospital, community, public health, and then it can be in sales and marketing, R&D, medical affairs. So all these are the role that we need to expand. So I urge all the pharmacies come together to unite in one roof, to work together to expand the role of pharmacists in Malaysia.